The kidneys. The kidneys are located on both sides of the vertebral column, outside the peritoneal cavity, which is the posterior region of the abdomen, at the level of the last two dorsal vertebrae, and the first three lumbar vertebrae. Approximately each one of the kidneys are the size of a fist. These are two bean-shaped organs that are given the job of making urine, filtering and removing mineral and the waste of liquid by the form of urine, removing the excess of fluids in the body, suppressing the acid from our cells that produce, and maintaining balancing our water. The salts and minerals from the body, such as sodium, phosphorus, potassium, and calcium from our blood. Also helps control our arterial pressure, produce red blood cells, and keep our bones healthy. When it comes to kidney care, there are several ways to keep your kidneys healthy. You have to choose healthy foods such as fruits, vegetables, grains, and dairy products and reduce the sugar. We also have to do physical activity for at least 30 minutes per day to keep your body active and healthy. Aim for a healthy weight so that you don't gain excess weight from your body. Getting a good night's sleep is also an important factor to keep your kidneys in a good health. With respect to how to damage the kidneys, there are several ways to do it, and my example would be the consumption of soft drinks, since this alters the metabolism of electrolytes and the pH of the body, which increases the blood glucose. Also, the foods with proteins damage the kidney, since they have to do a bigger job to process these kind of foods, and drinking a few amounts of water can make the kidneys do his work in not a good way, since they require the consumption of this substance. And consuming food with a lot of potassium damage it, since it must eliminate the excess of potassium that is from, and it can accumulate. The consumption of salt causes the blood pressure to increase, and having high blood pressure can hurt the kidney by passing blood. And continue with the thing of the diseases. Most of the diseases of the kidneys cause them to not be able to eliminate the waste of the things in the body in a correct way. The causes include why this occurs are various genetic problems, injuries, or medications, and there is a greater risk of suffering from a kidney disease if a person has diabetes, high blood pressure, or it has something to do hereditary. And the kidney diseases can include cancer, cysts, stones or kidney stones, and infection. It should be noted that diseases are of the most frequent since, according to the medical blog Did Control, it is the third most frequent urological pathology after infections and of the prostate. And it is estimated that 12% of men and 6% of women will have an episode of kidney stones through their lives. And the kidney stones are deposits made of minerals and salt that form in the kidneys, which can damage it. These can be prevented also if you have a history of kidney stones in your family. You can drink plenty of fluid to produce enough urine, and take medication or make changes of your diet so they don't cause any stone. And the causes of the kidney stones are formed for several, since these do not have a unique way of creation. They can be formed by excess of weight, some medical conditions, eating food, and these are formed based on or can be hereditary. They can form in weeks or even bones, because these are formed based on calcium, which are the most common and occur frequently in men between the ages of 20 and 30 years. And these are mixed with other substances to make the stone, which is the most common. The symptoms you suffer when you have a stone are diverse. Some left few are going to be named, such as intense pain that begins and disappears in the abdomen, which can be passed through the groin and testicles in the men, and in the vaginal lips in women, and blood in the urine, fever, nausea, vomiting, pain under the ribs, pain when urinating, constant need to go to the bathroom, and pain that comes in waves and is variable intensity. Also, in some cases, there is no discomfort until the stone goes down the tubes from the ovaries to the bladder.